There's a tumor, there's something. I was freaking out. Severe pain in the lateral knee, especially on the right side. Limited ability to stand up in the morning out of bed, to bend over, to pick up something would cause more pain up and down both sides, and then it would go into both sides of the hip and the back. The back would be out of line. You could actually feel it in the sacrum area. Limited ability to walk fast. Locked up muscles in the quads were a real problem. I tried stretches, I tried heat, ice, Aleve, all the typical things that you would try until nothing was making any difference. When it got to the point where I could hardly walk very much, I knew that we had to do something. I went to my MD and basically diagnosed it as a back problem that needed an MRI and possibly surgery. Suspected that it was a herniated disc. I knew in my heart and my gut it was something else.
A lot of times whenever people come in with a herniated disc, sometimes their symptoms can present like a herniated disc, but in actuality it can be something else. I took a look at her and I found some things that weren't moving as well as they should, and when the source of her pain was actually not really the herniated disc, it was actually something different. She had an SI joint restriction. Once I found that out and worked on a plan to get that better, she was able to recover pretty quickly. First, to get the joints to move the way that they should, because if you do have a restriction at one area, because everything is connected, it'll trickle to other places of the body and then cause some compensatory movements and further contribute to the symptoms. So I had to get the joints to move better. So we worked on that, and along with the joints, the muscles usually respond by tightening up to create some stability to protect that area. And so we also worked on that. That was the next thing, kind of working on trying to get mobility within the muscles. And then after that, trying to create some stability, work on imbalances, work on symmetry, and then try to put that whole entire process to something like function, running, squatting, lifting, pushing, things that she had troubles with. She responded really well. She responded actually pretty quickly.
I ran upstairs and shocked myself and said I can actually go up the stairs without hurting, so I can go up the stairs a lot quicker now. Every now and then I'll run a little bit just to see if I can do it, and I can.
When she came in, she had a lot of things that she couldn't do that she wanted to do. She was very active beforehand. It's really debilitating for her.
The more I started coming in, the more things started loosening up. The lunges, I can do those again. I can do jumps again. I couldn't jump. None of those things. And walking up the stairs is not painful anymore. I found that if I did not do what Mitchell had assigned to me for that week, that the pain can come back and the problems can come back. So I consider this to be a lifetime thing, because I do not want to go back to where I was. As long as I follow a daily routine, then I can keep it under control or manage it. Managing is a good thing. That's a positive thing. I do have some really important advice for anybody that comes to Siskin and works with any physical therapist at all. That doing what they tell you to do and being faithful to what they tell you to do and when is pretty crucial for you getting better. So do what they tell you to do.